Every day, you and I get bombarded with negative news. And just like our bodies becomes what we eat, our minds become the information that we consume. If you want to stay positive, it's so important that you also listen to stories that inspires you and uplifts you. In this podcast, we interview world-leading experts dedicated to solving the world's most pressing problems. And if you stick around, I promise you will not only be as informed as if you watch the news, you will feel uplifted, inspired, and have more positive energy in your life. Welcome to Great.com Talks with. Hi and welcome. Today Great.com talks with Bill Keck, who is the Executive Director of MEDICC.org. And if you haven't heard of them before, MEDICC promotes US-Cuba health collaborations. And if you're new here into this podcast, you definitely want to press subscribe, either on YouTube or in your podcast app, because today we're going to explore how health can be possible for everyone and what we can learn from Cuba's health system. So, Bill, thank you so much for taking the time to speak with us today.
Pleasure to be with you, Emil.
So how would you describe MEDICC to someone that has not heard of your organization?
Well, MEDICC stands for Medical Education Cooperation with Cuba. And so we call it MEDICC for short. MEDICC is a US-based, not-for-profit organization founded in 1997 to, as you mentioned, promote collaboration between the US and Cuba in matters related to health, and also to highlight Cuba's public health contributions to health equity and universal access to care. They actually have a model that we could learn from in the United States, but certainly many other countries in the world could learn from the Cuban model. So we've been in existence now almost 25 years and have a number of activities and programs that we use to try to meet that mission.
Beautiful. Thank you for that. So why do you think what is the Cuban model doing well then that makes it worth trying to replicate?
Yes, it's a fascinating model, particularly for those of us in the United States where we haven't managed yet to achieve universal access to primary care. You know, Cuba is a middle-income country, much poorer than us and much poorer than the Western democracies. Yet they've managed to create a population with a health status that is equal to that in the United States, superior to us in some aspects, a little inferior in others. But they've managed to do this at something like 1/8 the cost per person. Wow. As our system or our industry really has managed to do. So they have been, and they've done this by providing doctor and nurse teams, over 11,000 of them now scattered throughout Cuba, where the health practitioners actually have responsibility for the health of the population that they work with. So they're assigned a certain population and they're evaluated, they're government employees, right? This is a completely socialized system. So they are evaluated on how well their population is doing in terms of health. And that I think is quite unique. There aren't many health professionals that have that responsibility around the world. Most of us trained in health were sort of trained to do battle with disease one patient at a time, but not necessarily from a population focus. So these folks do primary care, the usual stuff, illness and injury care, prevention and treatment, but with a heavy focus on prevention and measurement of outcomes. So they do a community analysis of health. They really have a unified system with, centralized policies and procedures, but a lot of local autonomy in order to adjust what they do to meet the needs of populations, whether they're predominantly older folks or families with young children, whatever their neighborhood or their target population might be, they are free and expected to adjust their approach to meet the particular needs that population has. And this is all done without cost to the patient. So it's really quite remarkable, especially for someone from the US, where we have a very expensive healthcare industry, really, that doesn't provide that same level of involvement. So it's a heavy load of prevention, focused on trying to avoid chronic disease and injury, trying to avoid the expensive things and the devastating things, minimize them, and trying to keep that population as healthy as possible. So it's really quite remarkable.
That is so interesting, because I come from Sweden, a country where we also have universal healthcare. But if I see something missing from our system, it's the preventive side of things. When I go to the doctor, I almost never get advice on how can I prevent future diseases. It's more treating symptoms. And I don't think the doctors have responsibility of people, and I'm not sure they're evaluated in the way that you describe here. So it's highly interesting.
Well, if you lived in Cuba, the doctor and or nurse would see you at least once a year, whether you chose to see them or not. They're expected to see every person they're responsible for, either in the office and or in their home. And it's in those home visits where they evaluate the home setting and situation and focus principally on prevention, early diagnosis.
Wow. So the doctor comes home to the patients?
Yes.
Wow.
Yeah. Yes. And then they take that information from those patients and correlate it into a report. It doesn't have patient names in it, but they aggregate that data into a sort of community diagnosis that they have to update at least once a year. So every physician's office does that. And that means then the government gets, state by state and for the whole country, a pretty good idea of what health problems are around the country. And what they've also put in place then is a series of what are called polyclinics, so that the primary care doctor, the family doctor, can have access to specialists when they're needed. So there are about 450 of these polyclinics in Cuba. So each one has a responsibility for somewhere between 30 and 70 family doctor offices. So if the family doctor wants help, he or she can get it very easily through the polyclinic, where there are more advanced diagnostic techniques and more sophisticated technology. And they then are connected, of course, with the hospitals and the medical schools and the nursing schools, the research institutes. So it's an integrated system from top to bottom, and the patient is followed through it all. If they move from the neighborhood into one of these other settings by the family physician, who is responsible for coordinating all of this and making sure when the patient comes back home that the rehabilitative services and communications that they need are in place. So it is one of the most highly integrated systems I've ever seen.
Wow.
Mm-hmm.
This is really evoking thoughts in me. So help me understand then, what are the downsides of this system then? What problems are they facing at Cuba? Like if you were to criticize the system.
Well, I think there are several. The major problem they have now is economic. After all, the U.S. has had a complete economic and financial embargo against Cuba for almost 60 years. That's been problematic. While they prioritize health, and in times of economic distress, such as now during the pandemic, they actually take money from other federal budgets and put it into health because that is their primary focus. But their healthcare professionals are poorly paid. So you have to be dedicated to this, to be willing to practice as a physician or a nurse or a technician or other healthcare worker in a system that just can't afford to pay very well. That's a problem. And of course, they're facing issues that all of us are, an aging population. They have I think, the oldest population now in the Caribbean and Latin America. Not surprising, because they're doing a good job of keeping people healthy and alive longer. But then, of course, they are facing the emergence of chronic disease, just as we are, and struggling to find ways to control it.
So how big is the difference then between, because if they're working more preventive, where do you see Cuba have successes when it comes to health? Is it in chronic disease, or is it more in which areas is this successful?
Well, it's most successful, it's hard to say. That's a difficult question to answer. Let me put it this way. Since they're very good at prevention, they are excellent there. So their children, for example, 98% of them are fully immunized by age 2 with 13 vaccines, most of which are now manufactured in Cuba. Because the other thing they've done is develop a big biotech and pharmaceutical development and manufacturing sector. So they're very good there. Because they are integrated, they do their best to provide treatment for chronic diseases as they occur. So they do fairly well, but they're limited in what they can do with high tech because of the expense associated with it. So that helps them even focus more on prevention. For example, they have a national chronic kidney disease prevention effort, where everyone is screened for the early markers of chronic kidney disease. And they want to prevent kidney disease progression because treating it with dialysis machines is very expensive. So besides, of course, trying to keep people healthy, that's one example of how they try to deal with medical issues in ways that keeps them from being cost prohibitive. So given their circumstances, it's hard for me to find anything substantial to criticize, quite frankly.
Thank you so much, Bill, for painting this picture. I feel like I'm learning a lot here. So you're obviously promoting US-Cuba collaborations. So from your point of view, which parts of the Cuba system do you think the US should take a look at and maybe implement?
Well, obviously our systems are very, very different. Going from a completely socialized system, which you're more familiar with, to one like ours, where we deal largely with private entrepreneurs in every segment of health. We think there are several lessons that apply to us and perhaps to others as well. One is the coordination from prevention all the way through primary, secondary, tertiary, and quaternary care, the various and higher levels of technical interventions for disease. The universal access to a physician. Every Cuban has a physician, and that physician sees that person at least once a year. Having access to that physician at minimal or no cost, so the barriers for access are diminished. And then infiltrating prevention into everything that's done. With the reality that primary care and family medicine are specialties that are highly valued in Cuba, unlike the way they tend to be in a place like the United States, where people really want to be specialists because that has more panache and income associated with it beyond family medicine. So we look for ways to help people make those connections. So we have 4 program areas that we do this. By the way, we did produce a film called Salud, which means health in Spanish. And it's a film about Cuba's international work, because they have tens of thousands of health workers working in anywhere from 40 to 60 developing countries around the world. That would take a whole other program just to begin to approach.
Wow.
So that film is about an hour and a half documentary. It's available online. If any of your viewers or listeners would be interested, they can find it pretty easily, I think, and see it for free. Then we have a journal called MEDICC Review. MEDICC Review is a online, open access, peer-reviewed journal indexed in the major scientific literature indices now that focuses on Cuban and Latin American praxis, that is, practice, activities, etc. And it's been around for about 10 or 11 years now. It is available free online, so anyone who's interested in what's going on in Cuba should certainly look up MEDICC Review and see it. It's in English, by the way, not Spanish. And that journal is now shifting its focus a little bit towards what we call One Health. That is the idea that the environment, the economy, the health status, et cetera, are all interrelated. And if we're ever going to get to the point where we have sustainable societies that are healthy, we're going to have to find ways to take the best science and integrate it in ways that we really learn how to do that without destroying the planet in the process. So we're focusing more on health in all policies. And that journal comes out quarterly, so every 3 months there's a new edition. Another thing we do, we call Community Partnerships for Health, which maybe gets back to your initial question of what the USA could learn from Cuba. We've sponsored a lot of people traveling to Cuba to look at the health system. Our organization provides the deepest dive possible, I think, into Cuba's health system of anyone. And I'll get to the travel in a moment. But we decided that in addition to trying to tell people about what's going on, we needed some examples. We needed to see if we could actually apply some of the things that we're learning in Cuba to communities in need in the US. So we have a group of 10 or 11 communities that have sent representatives from, that is, health educators, public health people, citizens, hospital CEOs, etc., to Cuba to see how that system is run, with the idea then that they actually always become inspired. It's amazing to watch. They are always inspired by what Cuba has so little is able to accomplish compared to the US, one of the, if not the richest country in the world. So they come back then and try to develop innovative approaches to improve health status in their own communities. So South Los Angeles, Albuquerque, New Mexico, Oakland, California, Milwaukee, Wisconsin, New Orleans, Louisiana, the Bronx, New York. All of these folks have neighborhoods there that have done this, and we are keeping them in touch together now as they learn and grow from each other and their experience in Cuba. I mentioned travel, so shall I go on, or do you have a question?
I wish we could explore more about the travels, but we're actually kind of coming up to the end of this interview now. And there's something I really would like to ask you, and that is, I feel inspired because I haven't heard of Cuba's health system before. My assumption is that a lot of my viewers have not heard about it either. So what can they do to take some kind of action step to spread this information and to create some kind of positive impact for, all of our health systems?
Well, I think there are several things that are fairly easy. Go to our website and look at the information that's available there. Go to the MEDICC Review journal and look particularly at some of the editorials, but also some of the articles will give you a sense of what's going on in Cuba. If they're in the US, then of course they could help us, particularly now that we've had a change in administration nationally, to reconnect with Cuba, because the Trump administration enacted 200 additional restrictions against US-Cuba cooperation. That is likely to be largely, if not completely, rolled back, and we'll have opportunities perhaps to go again. And if people really are interested in learning more about Cuba, then go to our website, and once the pandemic ends and travel is possible again, consider signing up for one of our trips to Cuba so they can get a close look at what the Cuban health system does. There are also, of course, many sources of information about Cuba, so you could do online searches for information about the Cuban health system, begin to learn about it. I could even send you an article or two if you'd like.
Yes, please. And
it's a lot.
Thank you for. I really feel like I learned something new today. So, Bill, I'm so grateful that you took the time to be a part of our podcast today. Very much appreciate it.
Oh, you're quite welcome. It's my pleasure.
Thank you. And for you listening, if you also enjoyed this episode, press subscribe on YouTube or in your podcast app, because that is showing the algorithms that this is an important conversation, so more people can hear about the Cuba health system and start thinking about how can we use that in other places. So thanks so much for listening, and we'll see you in the next episode. What is great.com? That is the most common question that we get. And the shortest answer I can give you is that we are a company that is moving money from the online casino industry and donates it to charities that is helping the environment. The long answer, unfortunately, I don't have time to tell you today. But if you're curious, definitely Google what is great.com to learn more.